views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening and welcome to Bronx Talk. Over the years, much attention has been paid to women's health issues. Understanding and dealing with health disparities in care and particular ailments and conditions that affect women are vital for the overall health of our borough and obviously for the individual health of Bronx women. But what about the men? While women generally seem more comfortable talking about personal and health issues, these are not the kinds of things that men, especially young men in the Bronx, concern themselves with. Stats show that they also don't access available health care as often as women do. And one of tonight's guests indicated to me prior to the show that life expectancy for men is more than 5 years shorter than it is for women. So that's the subject of our show tonight, men's health. We'll talk diabetes, prostate cancer, heart disease, ED, obesity, and much more. We should also mention that there is going to be a men's health event at a barber shop where the men go on Laconia Avenue in the Northeast Bronx, and that'll be this Tuesday, actually a week from Tuesday the 19th. You'll hear more about that from the barber himself in just a moment. Also, we've got a Bronx doctor on hand to talk about us guys and how we can get healthier. So please join me in welcoming the Associate Medical Director for Community and Public Health and Satellite Centers at Urban Health Plan. It is Dr. Richard Torres. Nice to have you with us, sir.
Thank you very much.
And the owner and operator of the Barber Factory. What a cool place, Nestor LeBron. Nice to have you, Nestor.
Thank you for having me.
We'll get to you in a moment, Doctor. Why don't you characterize what I was just talking about? How are men doing in the Bronx? I suggested very directly that we need more care. Give me an overall look at guys and our health.
So in general, men, as you mentioned, access health care much less than women. Men usually don't do enough health screenings. Men don't go to the doctor very often. Men don't follow up with their doctor. Men don't take medications compliantly. So in general, men are doing pretty poorly in terms of continuing their preventive health measures. And this has to change.
It certainly should change, and we're going to try to make that point in a very big way tonight. Why do you think that is? One would think that we all want to be healthier. Is it a macho thing?
Yeah, I think there's different variables. I think macho is probably one variable. The other variable is that men don't think they're vulnerable to health conditions sometimes.
Superman.
They're resistant to divulging personal health information to other providers, to physicians. They are working, they're busy, family, and they tend to ignore their health until a crisis happens. You know,
I'm gonna soften the frustration with my brothers, my fellow Bronxites, and say, yeah, I guess there is that Superman attitude, that macho attitude, but I think being busy, and if you're a good man and you want to, certainly you have a family and you want to be the guy, you don't want to take the time that I got a problem, I'm helping my wife, I'm certainly helping my children, and yeah, I'm fine, I feel good and I'm fine, but that's not helpful, right?
No, it makes total sense. I mean, hypertension, for example, it's called the silent killer, because unless you test yourself, you don't know if you have high blood pressure. So men who
go to your doctor, of course.
So I think in our conversation about barbershops, it's critical that men have screenings for health conditions like blood pressure, and then that might reveal that they have uncontrolled high blood pressure.
I mentioned some of the ailments that may be confronting men right at the top. From your perspective, if I were to say to you, what's your biggest concern about men in the Bronx, or concerns? List them kind of in order for me.
Okay, so the number one concern is heart disease, obviously, because it's the number one killer for humankind, right? In men and women, and in the Bronx for men also. So anything that's related to heart disease, that would be any cardiovascular illness, that would be stroke, history of heart attack, angina, high cholesterol, all these things that contribute. Cigarette smoking, physical inactivity, all this contributes to heart disease.
I wish I had my pen. I had been taking notes because these are really important things to note.
So heart disease is very important, and checking your blood pressure and other risk factors that lead to heart disease, diabetes, screening for diabetes. The second most common condition that causes mortality in men is cancer. So it's important, especially in, say, African-American men and Hispanic men, that prostate cancer is at a high prevalence. So screenings for prostate cancer, colon cancer, lung cancer. So these conditions also are pretty prominent. The third important thing is they call it unintentional injuries. So that might be, believe it or not, homicide. That's directly related to conditions related to poverty and urban conditions.
Workplace injuries, I'm sure.
Workplace injuries, obviously, yes. And accidents also contribute. And then beyond that, there's other issues like diabetes or kidney failure and related.
Well, now that we're all depressed, no, not at all, because these things can be dealt with. I mean,
Yes.
and Doctor, as you know, the trend nowadays in healthcare is to treat people as whole people, and that you stick a needle in their arm, you're not quite curing them if you don't cure the symptoms, understand who they are, understand their behavior, and that's where we bring my friend Nestor in. I'm going to tell you this is a crazy story I thought of on the way over here. So when I was in summer camp, we would sneak out at night and go behind the girls' bunks to listen to what they were saying, just because who knew, were they talking about us? Just to hear what they were saying and hopefully learn something more about the world, I suppose. You have this unique opportunity. You're in the boys' bunk all the time. You called it a man cave. You told me.
The man cave, the man hub.
Before we even talk about health, just give me a status update. Bronx guys who come by, what do they say? What do they talk about? What are their concerns? What do they like? Give me something.
Well, to kind of piggyback off what the doctor was talking about, I'm gonna tell you a story. I have a good friend, 44 years old, who suffered a massive heart attack. And we asked him, he's a client of mine. I hadn't seen him for a while. He came back to the barber shop and tells me, I suffered a massive heart attack. I said, have you gone to the doctor? Have you been checking yourself? He said, no, I've been working so hard that I haven't gone to the doctor in 3 or 4 years. And that happens frequent. That guys don't know, they're too busy working, they're too busy moving around, and they're...
This is exactly what I was saying, is that I'm sympathetic to what the doctor said, that we were talking about macho, where you feel like Superman,
Yeah.
but sometimes it's because they're too dedicated, because they just want to do
Exactly.
well, and there's a lot of pressure on them. I mean, financial pressure and other kinds of pressures, with work pressures. We know you got to keep your job and all that kind of stuff. Why do you think, do you have a condition? I mean, I know you're not a psychologist, but I'm sure in your job you are in some form. Why do you think guys maybe don't go to the doctor? I mean...
Well, in my neighborhood, I'm not maybe resources.
Access to health care.
A little bit of the macho, and, the scheduling,
distracted.
timing, but definitely access.
And then I guess it's particularly frustrating when you hear a story like that story, that here's somebody who had a massive heart attack
44 years old.
44. Who knows? I mean, listen, we all do things that maybe, are not the best things for us, but maybe some of that was preventable.
Yeah.
Talk to me about why you would take the time and go through the effort of setting up this men's health event.
Well,
and at a barber, when it came to me that it was coming to a barbershop, I said, well, now that makes sense.
Well, at the barber shop is where most men hang out and talk and gossip. Is where we, this is at the barber shop. We'll be able to talk to each other. We talk to each other about things that you normally wouldn't outside, and so bringing this event will help the awareness for the guys, for the health awareness. We're bringing insurance companies to get them access to insurance, screenings, blood pressure screenings, all of these things that maybe if they don't have the chance to do, well, at the barber shop where they frequent at, we'll be able to get that done at least once a year.
Dr. Torres, talk to me about not only getting them in. I mean, I'm hoping we made the pitch to get guys to go. You know, what are the things when you look at them that you say, you know what, you got to do this? Are there preventative measures that you would recommend? I mean, certainly you say stay healthy, stay active. I mean, that helps.
Yeah. So
give me an idea of
yeah.
advice or what we're talking about.
Yeah, so, the most difficult thing to change in humans is health behavior. And it's
Really?
very, very difficult to break a habit. I think the barbershop venue is excellent because it is a place that they'll feel comfortable coming to. It's familiar for them. It's used quite often in the black community, in the black churches and the black barbershops as well as Latino barbershops and so on. So it makes them feel more comfortable. I think men need to know where they stand. I think that's the first thing. So if you screen them, check their blood sugar, their blood pressure. If it's uncontrolled, then they need to go further and get more information. I mean, that's the first step. Know where they are. And then from there, give them an idea of lifestyle modifications, which is always the first piece of treatment. That would mean exercise a little more.
Well, I want to
weight
get into
loss.
that a little bit.
Exercise, lose weight. You mentioned ED a little earlier, and it's directly related to uncontrolled hypertension, uncontrolled high blood pressure, and diabetes. So that I think when you get to very sensitive areas of men's health, they start to listen a little more, and when they see results, lowering their blood pressure to normal, controlling their blood sugar, then they see results in terms of ED, for example, they listen.
I want to just touch on that for a moment because diabetes affects it, heart disease affects it, certainly prostate cancer affects it.
Yes.
And I know you're going to have a speaker about ED.
Dr. Bob Barucham.
Barucham, who's an expert in this.
He's an
kind of thing.
expert, yeah.
One of the things that I learned through Dr. Barucham and other presentations, that these are treatable things, and guys don't want to talk about it. I mean, there's injections, maybe not as pleasant, but certainly there are pills which are widely publicized but not covered. Maybe you can talk to you. And then there's also implant technology, which apparently works very well.
Yeah, definitely. He's one of the leading doctors,
Leading experts in
leading experts in ED, and he's going to have a seminar over there.
Do you think that it is difficult to get, like guys, I'm sure, don't sit in the barber chair and say, hey, I've got this problem. It's a very personal problem, very difficult problem to admit. But maybe if we make it aware, do you think that maybe they learn something?
Well,
we'll find out.
Absolutely, we're going to find out. It was hard for me to get guys to register. It was like, guys, come on, we have to talk about things. So we had to talk about the hypertension, talk about prostate cancers, and kind of like ease them in. And also, ED is definitely, there's an expert coming in ED. And guys were kind of like shaming away from it, but then, we're providing the information.
Information, number one, and number two, it's treatable. I mean, that's what I'm
But
hearing.
guys don't want to talk about that. Guys don't,
We're talking about it on TV,
We're
folks.
on TV now because we're good, but, guys don't want to talk about that. You want to be a Superman, and you want to make sure, everything is good. And
So I don't know if they
Denial.
put it...
Denial.
Yeah.
Yeah, I don't know if they put it up yet, but there is a website, and we're going to try and help guys along.
edu.org.
edcure.org.
edcure.org,
So if they
yes.
can put that up at some
Absolutely.
point, that'd be great. Let's talk a little bit about, and I want to go the holistic thing. Guys come in and talk about their families, talk about their children, talk about their... give me
Everything.
Oh, I want to hear. It's like sitting outside the girls' bunk. I want to hear what the guys are saying.
I've been at the shop for 10 years, and I say that for 10 years, I've been absorbing so many different lifestyles and so many different stories, because it's like every single individual that comes in has a different situation. So it's like you sit there and guys are talking about their relationships and who broke up with who, and sports. Sports obviously is a big, a big thing at the barbershop.
You're a Bronx boy, that's where
Exactly.
that drives
But
you.
guys are definitely talking about, things, important things, health. We do talk about health every once in a while.
That it gives you, they say, I remember the old commercials, only the hairdresser knows for sure. Yeah. And so it gives you a little bit of insight, I think.
Yes.
And so I guess that's what this is all about. Talk to me about, again, let's go back to the education piece, which is such a vital piece. aside from this, which I think, and that's why we took the time to do it, is such an important event, what kinds of things can be done outside of holding an event, putting it on TV, that can be useful in helping guys? Because I know what we're saying. We don't listen to anybody.
So I think that this venue is so excellent because actually what he's been doing is very therapeutic for people to come in, for men to come in and express themselves and have that opportunity to think about what's going on in their life and how they can address it. And by having health screenings there, I think is very beneficial. Beyond that, I think even if, let's say, 40 people register, they're going to contact 40 more people. And it'll continue to develop. And I think allowing more health screenings and giving that little window of opportunity, they might talk to their brother or their uncle and say, listen, I heard this, really? When is the next event? So it's going to be very, very popular, and I think a great way to do it. The other things that we do is...
now, I want to hear also about Urban Health Plan and those kinds, because I know this is not just stick a needle in your arm. This is an active organization that really works on community health.
So Urban Health Plan has been in existence for 40 years, and it has offices in the Bronx, throughout the Bronx, Central Harlem, and Corona, Queens. And it's an extremely large, federally qualified health center that provides primary care and subspecialty care and does a lot of work that deal with what we call the social determinants of health. We have a kitchen, we teach healthy living, healthy eating, dieting, exercise. The program, Urban Health Plan, has many community-wide events that not only are related to prescribing and screening and diagnosing, but how people can live healthier lives. And this is critical for the organization because it was founded by Dr. Izquierdo over 40 years ago.
And they named the street after him.
Exactly, on Southern Boulevard.
That's right.
And the Mott Haven, South Bronx community, of which I grew up in, is one of the poorest communities and one of the unhealthiest communities in the nation. So we have very high risks of many chronic illnesses. And we need to reach out to, in this case, men, recommend screenings. One thing that I'd like to just touch on, we didn't touch on it, was HIV, which is also has a high prevalence in the Bronx, and particularly in Latinos and more so in African-American men. For example, in African-American men, the lifetime risk for HIV acquisition is 1 in 20 men. That's huge.
Wow.
For the general population of men, it's about 1 in 320. And then if you're a gay black man, the risk is 1 in 2 in lifetime. 50% of black men could develop HIV.
Scary as can be.
It is amazing. And it's amazing that we do have, treatment today that can help prevent HIV. It's called PrEP. And it's important to get the word out to patients. Even at this event, just giving them information about the availability of preventive treatment for HIV is very critical because our goal is to end the AIDS epidemic. And New York State, in particular, has done a great job at trying to get there, and we're having fewer and fewer cases and spread of HIV, and people are living longer and healthier.
But it's still, at least according to the numbers you presented, is an epidemic amongst men of color in our home borough of the Bronx.
Yes.
I wanted to ask you about neighborhoods. Do you say, well, this neighborhood is more prevalent for diabetes, and again, we're talking about men, or prostate cancer, or something else. Does it go from neighborhood to neighborhood?
Exactly.
It does.
And it's pretty much related directly to the financial status or socioeconomic status of the communities. So you might have the Riverdale community versus the Mott Haven community, and they're probably directly opposite in terms of
you think it's
health
financial?
status.
And
that plays a big
my
role.
question would be access.
Well, financial and having health insurance, right? And having the availability of healthier foods, more exercise facilities, having financial capability of going to a gym.
It would really be interesting, and I don't know if a study like this has been done, maybe in other places, but it would be very interesting to take a map, like we do with CompStat with crime, and pinpoint where are the gyms in the Bronx, where are, obviously there's doctor offices everywhere, but where are concentrations of medical centers, and then trace what diseases
related.
crop up in those neighborhoods, and then say, well, wait a minute, I don't want to finger anybody's neighborhood, but in the Northeast Bronx, maybe we need more gyms, or maybe we need a better access to food.
Well,
Some of it's predictable because it's
yeah.
logical.
Yes.
But it would be interesting to do that study.
Yeah,
So pour it out
actually,
to
the New York State Department of Health has some good data on health and also social determinants of health. And you're not going to find a Whole Foods on Southern Boulevard, right? You're going to find a lot of smaller groceries and smaller supermarkets, and they'll send high glucose content foods. Actually, Urban Health Plan has a program where they associate with facilities, grocery stores and pharmacies in the local communities, and recommend healthy living. And they go in and invite the owners to participate in healthy ways, and they bring healthier foods more to the front of the store. They teach them about what has high sugar contents and what are fatty contents.
I had this conversation, I forget when and where it was, but I believe it was in the Concourse Village area. It goes back a year or two. And we walked into different bodegas and other stores and tried to just examine what you were talking about, was product placement.
Yes.
And in a couple of the bodegas, when you walk in, and on the left side was the drinks.
Yes.
And it was all beer in the front, and the juices were in the back. And listen, I know the guy wants to sell beer, and I appreciate that, but that's not helping the community, because if somebody walks in and is thirsty and sees water and maybe juice, if you will, you got a better shot than if they walk in there and they see beer. Talk to me a little bit, just in general, about the Barber Factory and what other, because I know you take the whole community thing very seriously. So like you talked about Urban Health Plan, talk to me about, other than giving great haircuts and making everybody look good. I mean, I was in there the other day and everybody was looking sharp and clean. But other than that, aside from health, what are your concerns and what are you working on?
We try to touch in as many topics as we can. We're very event-driven, community-based barbershop, so it's like we're constantly doing events. This one now, the Men's Health one, it's dedicated to Men's Health Month, which is now June, right around Father's Day.
Oh, that's right, yeah, good time. Very
right?
good.
So we also do a lot of educational things. We started this thing called Pack a Bag, where we put together about 350 bags, was the first one. 350 backpacks with books and stuff and materials for the kids, and every kid that gets a haircut gets a bag. So we do those things. We have a fishing trip coming up. We invite everybody in the community to come on, and just things to kind of keep everybody together and aware.
This all contributes to health, and if I wasn't rooted into the chair, I'd stand up and applaud, because, a lot of groups do a backpack event, but they don't do it through fathers or through the guys, and you make sure that the guys are involved.
Yeah,
and then we go back to the doctor and say, do these things affect health? And of course, it's a rhetorical question. The answer is, of course they do.
Of course they do. They're very, very helpful. They alleviate stress.
Absolutely.
They build knowledge, and this all down the line leads to healthier living.
I was thinking
smarter
of,
living.
when I presented the program in the beginning, and I was thinking about women and mothers who, often are traditionally thought of as caring for the health of their children.
Yes.
But if you, and I'm just talking to my friends, my brothers in the Bronx, if you want to have your young boys grow up and learn to take care of themselves, if mommy says it, but daddy doesn't say it, the kid's not going to learn. But if daddy represents and says, okay, I'm going, you know what, you come with me to the doctor, or I'm doing it because daddy wants to live a long time. We all want to do that. What about smoking, doctor? I mean,
smoking.
It's the evil, it's the root of all evil, right?
Yeah, I mean, it is the number one preventable, modifiable risk factor we have. So if you can reduce your cigarette smoking, if you can stop it.
Guys are still smoking?
A
lot of guys are cutting down, though.
Well, that's cutting
down.
Smoking has significantly.
They've done a
came
lot
down.
of excellent work in the state of New York to help smoking cessation. There's been a lot of programs, a lot of coverage now through all the insurance programs to reduce cigarette smoking. And it leads to heart disease, to high blood pressure, to ED. So it's clearly, if you could stop smoking, that would be the first thing to do, I think. in terms of
if you
improving
do
your health.
still smoke.
If you do
and,
still
and
smoke.
again, listen. All right, so you want to take risks on yourself, but look at the kids around you.
Exactly.
Look at if you're a teacher in a school and they see you lighting up a cigarette. It's just not going to help those kids, you know?
Yes, they will.
All right, so let's wrap it up. It's Tuesday the 19th. At what time?
Tuesday the 19th. We start about noon.
Wow.
About noon. It's a whole day's
Men's
event.
festival.
It's a whole day's event. We're going to be cutting hair, obviously, first thing. We're going to have screenings, HIV screenings, all the blood pressure screenings.
Right.
We're going to have nutritional education.
Right.
And we're going to have a juice party.
Oh, there we go.
So instead of standing around drinking beer, we're going to drink juices.
There we go. A real health event.
A real
you know what?
health
I'm
event.
gonna do something that's unfair. Maybe Dr. Torres will stop by. If
Yeah,
you get 2
definitely.
minutes.
I'm
that would
invited. I'll
great.
be there,
I'm
yeah,
gonna
for sure.
certainly try and stop
Hazeman, he
by.
has his
Okay.
spot.
Yeah,
So
that's
Barber
right.
Factory is where?
4131 Laconia Avenue,
Laconia
Bronx,
Avenue.
New York,
Nice
10466.
little place. And I got to tell you the truth. And if you're a Bronx guy, you know what it's like. I found a parking space. Look,
And we
you
have
know.
free parking.
Oh, I didn't realize that. I got the
good.
space right in front. Anyway,
key.
Dr. Torres, say hello
Thank
to
you.
Paloma and all
I
my
will.
good buddies over there.
Thank you for inviting us. Yes.
Yep, and
Thank
Urban
you.
Health
Thank you.
Plan.
Thank you for
And
having
you, I'm going to be in there in just a
Couple
week or
days,
so.
yeah.
Okay, so is there a phone number or contact or website or anything for
www.thebarberfactory.com.
the www.thebarberfactory.com. Dr. Torres, thank you.
Thank
Nestor
you.
LeBron, thank you.
Thank you.
There we go. There we go. If you have further questions or comments on anything you heard on tonight's show or anything going on in the Bronx, then email them to us at BronxTalk@BronxNet.org. You can send us a tweet at BronxTalk or post them on our Facebook page. We'll read them on the air during a future edition of our program. And I do want to mention, if you have a health problem, and it is a personal health problem, you could send it to us. Obviously, I'm not going to get involved, but I will forward it to Dr. Torres, and I can guarantee you he will personally help guide you, whether it's with health insurance, whether it's advice on some of the issues we talked about, how to go about doing it, because we all want to keep our guys healthier. That's what we're going to do, okay? Absolutely. We make that commitment. We would ask Nestor, but he does more with the hair than the health. We'll get Dr. Torres involved. Anyway, you can find Bronx Talk by following the watch menu on the new BronxNet website. And also, we want to make sure to thank our producer, who is Helen Greenberg, our director, who is William Guzman, and all the other folks, the thousands of people who are around us. And we'll see you next week. Good night. Go men, Bronx men. Do it.